Your blood pressure's through the roof, your heart's pounding rapidly trying to jump out of your chest, while your good old doctor keeps piling on the meds as you get sicker and sicker and sicker. What should you do next? So Camille, tell us about this 74-year-old lady with high blood pressure and heart palpitations.
So she came to our practice trying to seek other ways to improve her really high blood pressure. Her readings would be about 150 over 100 millimeters of mercury, and she would get frequent racing and fluttering and pounding sensation in her chest. And her other doctor was recommending more medications, but not doing a lot of testing or investigation. And, she wanted to try a different approach.
So basically, she just had a myriad of problems: high cholesterol, high blood pressure, which we commonly see. And oftentimes when we see individuals with multiple problems, it may seem like they have, 10 different problems, but really they're just 10 different manifestations of one underlying problem. I think this is an important thing to consider for these types of patients. Upon her arrival, what was your initial evaluation?
I was suspecting a lot of inflammation, and her testing did show that her levels of inflammation in the body and the blood vessels were really high. There's some liver inflammation as well. We saw some arrhythmia on heart monitoring. We ruled out any heart failure, though. During this time, she also shared with us that she was having insomnia for a very long time, and we know that that increases risk of high blood pressure and heart disease as well.
Wow, so she had a variety of things, and I can understand why her doctor would try to put on multiple medication. Got the insomnia, so there's a pill for that. The heart rhythm, there's a pill for that. Cholesterol, high blood pressure, there's a pill for everything. However, when you get to the core problem, you can avoid all the pills by getting to the core problem. Now, you mentioned a heart rhythm abnormality or arrhythmia, and many individuals may not know what an abnormal heart rhythm is, but essentially the heart has its own electrical system, and there's electrical signals sent through the heart muscle from the top to the bottom, and the signals are sent in an organized fashion, and it's sent at a controlled rate. A normal rate for the heart is somewhere between 60 and 100. Ideally, you want it somewhere around 60 to 70 or 60, not higher than 80 beats per minute. But also, there's an order to the electrical signal. So sometimes a signal may initiate in part of the heart that's an abnormal heart where the signal initiate, and the signal may be erratic. It may be very rapid and irregular, and so we call that an arrhythmia. It's an abnormal rate sometimes, too fast or too slow, but it's an abnormal rhythm. It's an abnormal order of the electrical circuit, and so that makes it an arrhythmia. And so she had an arrhythmia that we saw, and so that's something we had to address also. And then there could be many different causes for this. But the insomnia, or the inability to sleep, was very important. And so she finally admitted that to us, and so we factored this into our equation. So how did we intervene with this patient?
So we prescribed her a 2-month detox, so raw plant foods, level 0 to 4B. And we also put her on a superfood called the premium green powder, which has a lot of prebiotics, probiotics, algae, spirulina to help cell function improve. And we also put her on an adrenal support supplement because we know the adrenal glands play a big role in sleep and rest and metabolism, and she was having an excess of adrenaline, and this supplement had various herbs and vitamins that support adrenal gland function. And then we also added a supplement to help with sleep that contains L-theanine, and that helps the brain chemistry and helps you fall asleep and get a more restful sleep.
Wow. I like how you took this approach because, again, the foundation was the nutritional cleansing. There are 2 parts to nutritional cleansing. One part of the nutritional cleansing is to remove all toxic foods, all processed carbohydrates, processed sugars, processed animal proteins, and dairy products, because these things can trigger lots of biochemical imbalances, which could cause many of the problems that this patient is having. And so you replace those foods with superfoods that are plant foods, minimally processed, And these foods can reduce inflammation. They can reduce oxidative stress, which again, it has a calming effect, if you will, on the body's biochemistry. And then I like what you did. You took a targeted approach because we strongly suspected that, as you mentioned, she had high adrenaline and maybe cortisol imbalances, which may have caused a sleep problem. So this is a great plan that you set out. I'm looking forward to hearing about the results. So how did she do?
She did great. So her palpitations actually went away pretty quickly, and she started getting better sleep to the point where she got off of her prescription medication for insomnia.
Oh, wow.
And we found, the reason for this improvement was a reduction in inflammation because her C-reactive protein went down by 84%. So that was really awesome to see. And we also saw that her markers of inflammation in the blood vessels and the liver normalized, and her blood pressure was much better. So it used to be around 150 over 100 millimeters of mercury, and now it was 135 over 80 without any medication.
Wow. Here's a fascinating case because here's a 74-year-old lady with a number of complex problems, and she could have easily been started on a number of medications, most of which, or perhaps all of which, have side effects. And we see patients like this who come in with a set of problems like this, who are started on medications whose health condition only get worse. So I could foresee someone like her getting sicker and sicker over time to the point where she's having frequent hospitalizations. There are other complications requiring hospitalizations and procedures. And so instead of all of that, we took a simple approach of cleansing her diet, taking the use of target supplementation, get a couple organ systems under control, and we allowed her body to correct itself. And this only took just 2 months. So instead of maybe 2 years or 3 years of misery and more medications and possibly more hospitalization, and who knows, procedures, this patient in just 2 months allowed her body to heal itself, and she's having a much greater quality of life with all of these health problems gone. So I hope you got a lot out of that. And as usual, if you have any questions or comments, leave them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, please like it, subscribe, and hit the notification button to see our next show.